Hi, how are you? Dr. Rick Mabanta. I wanted to cover some of the basic steps that you would go through a chiropractic course of care. There are a few mistakes that I often see people make as they're going through a course of chiropractic treatment and correction. So I want to relay those to you because sometimes you can lose some of the benefit, and I want you to have the best possible outcome from your chiropractic treatment. So the thing to consider is that there are three distinct phases of treatment. The first phase is the acute phase. It's often when people come and they're having a lot of pain or symptoms. The second phase is the corrective phase of care, and that's when the spinal correction is accomplished, where spinal function is improved to the degree that we have the highest level of alignment, mobility, stability, and strength of the spine. And the third phase of care is maintenance care. Once that optimal correction is accomplished, we want to hold that and maintain that for a longer period of time so that your body can continually control, coordinate, reorganize, and rebuild your body based on its optimal neurological expression. So what I often see is people come in for their acute phase of care. They do well with it. They'll have a reduction of symptoms either very quickly or sometimes a little longer period of time, but oftentimes it'll come to a point where the symptomatic phase is resolved. And many people make the mistake at that point to discontinue treatment. They don't have the pain, they don't have the symptoms. However, the spinal correction, the optimal restoration of the spinal health is not accomplished. And when you never reach that point of optimal spinal correction, you never have the best ability of your nervous system to do what it needs to do, which is control, coordinate, and organize the function of your body. The job of your nervous system is to take all the information it's exposed to from your environment, the stress factors, the chemistry that's going on in your body, and control and coordinate and organize that in the best and the optimal way for you at any given time. So the corrective phase continues while oftentimes the patient is not symptomatic, there's no pain or discomfort. However, corrective spinal care is still delivered at that time, still isolating those areas of the spine where it's not moving properly, where there's abnormal neurological activity indicated usually by muscle tone imbalances, and we continue the corrective process. During this phase is actually when we get the best correction accomplished because we're not working against inflammation, muscle spasm. The nervous system is more receptive to the restoration process, the correction process. It's out of the acute phase where it's not in the guarding, protective, sympathetic nervous system dominant phase. So that corrective phase is a very important phase. Through that phase, though, understand that there may not be a lot of pain or symptoms. So I want you to get that so you can get through that phase of care or reach optimal spinal correction so that your body will be as healthy as it can be and so that you don't revisit that acute phase again. You don't go back into a painful cycle again, which is often what happens. People will come back after they stop the acute care and they return oftentimes with worse pain, worse symptom, worse damage to the spine. So getting through the corrective phase is so important, so don't make that mistake. Third thing is, once we make the correction, we want to keep it and maintain it and hold it. Holding it is like when you make a beautiful garden in your yard and you have all the weeds taken out and you're watering it, giving it sunshine, giving it nutrients, and the plants will grow healthy. That's kind of what's happening when you're in your maintenance phase. We have everything corrected. We have optimal conditions. Maybe we discuss some things about nutrition or activity or exercise or emotional, mental function, what you're thinking and feeling, and keeping that as optimal as possible while we're feeding that information into your body and your body's reconstructing itself into a healthy manner. That occurs during the maintenance phase. So holding, maintaining proper alignment and spinal function for optimal nervous system function, and then working on the other 5 facets of health, or the 4 facets, remaining 4 facets of health. So those are the 3 phases: acute phase, corrective phase, and then maintenance phase. And people will often maintain their spines throughout life, which is important. Think about the job of your brain, nervous system, spinal column, what it does. It controls, coordinates, and organizes the function of all other systems of the body, allowing your body to express its inborn innate intelligence. So I hope we make it through all those phases, you reach optimal health and wellness, and I look forward to seeing you on your next visit. Take care.